Hello all of you, welcome back to my channel which is Medico Doc, and today we are discussing about the topic related to the pancreatitis. Firstly, I just want to tell that I am having an handwritten notes, so I'll be definitely attaching those notes with my sort of videos, so you can just check out whatever I am speaking I have written also, so you can just revise through that. So without wasting our time, let's discuss about the topic related to the pancreatitis. So first I just want to tell what is pancreatitis. Pancreatitis is an inflammation of the pancreas. Now whenever we are discussing about any sort of topic, we just get to know that what is the location of that organ. So pancreas is located behind the stomach, and it's a small organ, right? And what does it helps about? It helps with our digestion. Now we'll be discussing that how many types we have for the pancreatitis. It's two type, acute and chronic, right? And with a sort of acute, we get to know that it's a shorter period of time thing, and chronic we'll get to know that it's a longer period of time thing. So first we are discussing about the topic related to the acute pancreatitis. So it's a condition where the pancreas becomes swollen, or we can say inflamed for a shorter period of time. Now we are discussing about the symptoms, like what are the symptoms of acute pancreatitis. So first symptom is that you will suddenly get in severe pain in the center of your abdomen, or we can say in a simple language, in your tummy, right? And you'll feel sick, you'll feel like vomiting, you'll be feeling indigestion, like digestion process, because of pancreas you get an digestion process correctly, right? So with that you're facing indigestion, and you'll be feeling a tenderness or swelling around your abdomen or your tummy, right? Now if we are discussing about the causes also, like what it can cause gallstones. It can be caused through due to the drinking much alcohol, and if it's a severe case, if it becomes a severe case, it can cause even though a bleeding. There will be a serious tissue damage, there will be an infection and cyst, a swelling kind of a thing that happens when it will become a severe case. And if we'll discuss, in a severe case, it can even harm your vital organs like heart, lungs and kidneys, but that happens when it becomes a severe case, not in a normal cases, right? So if we are planning to diagnose, like how we can diagnose this acute pancreatitis, so we have to check as a doctor, you have to just press the belly to see if there is a tenderness present, and you have to check the BP, if it's a low BP, low fever, and there will be a rapid pulse. So these are the diagnosis process when a doctor is just checking the patient. So there would be a tenderness present, there would be a low BP, there would be a rapid pulses, and there would be a low fever, right? Now if we are discussing related to the test, so there will be a blood test to test two of the digestive enzymes, that is amylase and lipase. Also you can check WBC, you can check the blood sugar, you can check calcium and liver function. So these are sort of a test which you have to do, because it can infect like a diabetes. It can be another problems also there due to this pancreatitis. So you have to check out all sort of tests, right? Now if we'll be discussing about the treatment related to the acute pancreatitis, you have to give antibiotics if pancreas is infected. There should be IV fluids through needle, and there should be a diet changing, like you should take a low fat diet, or do some sort of a fasting, so you can manage your digestion process. And if you are facing any pain, so you have to give some medicine for that too. And if it's sort of a severe, So you have to do endoscopic retrograde cholangiopancreatography, that is the ERCP, right? If it's infecting a gallbladder, there would be a gallstones and whatever sort of a things. You have to do a gallbladder surgery, you have to do a pancreas surgery. So these are the sort of things which you have to do when these cases become severe, right? So that's sort of a points which you have to remind related to the acute pancreatitis. Now we switch to chronic pancreatitis. Chronic pancreatitis, which is, I already told you that is a long lasting inflammation, and this happens when you drink a lot of alcohol for a period of time. So definitely first factor is, if you are drinking alcohol, you have to leave alcohol at anyhow. If you want and treatment, there would be a modification for this too. And it's a condition where pancreas has become permanently damaged from inflammation, and it could be stopped working properly, right? So because as it is a long lasting inflammation, so definitely there would be, and chronic sounds a chronic thing, like highly thing, right? So that would be a permanently damaged from inflammation, or it can be like pancreas stop working completely. And if we discuss about in age, it can affect at any age. And if you want to know that in which it's sort of common, so that is more commonly in men's, right? Now we'll be discussing about the symptoms, as we already discussed about the symptoms related to the acute pancreatitis. So let's discuss with chronic too. So there would be a constant pain in your upper belly, right? And that radiates to your back. Okay, so what I told you, that there would be a constant pain that would be to the upper belly, and that radiates to the back. So that is the main symptom. How we'll get to know that it's a chronic or it's a acute. So but this pain can be disabling, like sometimes this gets stopped and then again this comes. And there will be a diarrhea, there will be a weight loss, because your pancreas isn't releasing enough enzymes, which are the two enzymes, amylase and lipase, as I already told you, right? So to break down food, so there would be a diarrhea, there would be a weight loss, because pancreas isn't releasing enough enzymes to break down your food. So there will be an indigestion. Okay, so there would be a vomiting, there would be your upset stomach, there would be oily or fatty kind of a stools that smells bad, and if you want to check out physically, that will be leave toilet to be filmy, as I can say, that would be leaving your toilet yellowish, or there would be some sort of particles that would be leave there. So you get to know, as a upset stomach, you'll get to know relatively these sort of things, as it is a chronic. Okay, now if we will be discussing chronic pancreatitis causes, so that would be include cystic fibrosis, there would be a family history of pancreas disorders, any of your parents might be facing through this pancreatitis before. There would be a gallstones, that was a cause includes in acute pancreatitis too. And there will be a high triglycerides, there will be a long time alcohol use, focus on that there will be a long time alcohol use. Okay, and might be you are taking a lot of medications before for some sort of things, might you had a surgery or some sort of a things, that also can be a cause include. Okay, now if we'll be discussing about the diagnosis relatively to the pancreatitis, which is chronic, so there would be a USG, you have to do CT scan, you can do, there could be endoscopic ultrasound scan, MRI scan, biopsy also for sort of cases which we can see here and everything. If you are discussing about the treatment, damage of the pancreas is permanent, as it's a chronic, it's a longer time of inflammation, but you can just have a treatment to control the condition. Okay, because damage happens which is a permanent. Now you have to change the lifestyle modification should be there. You have to stop drinking alcohol, you have to stop smoking. If you're facing any sort of a pain, you have to give the painkillers. There should be a surgery if you're facing a lot of pain, and that can help you with the treating those sort of a blockage. And you can give a pancreatic enzyme to help your body get enough nutrients from your food. Okay, and if you're facing a diabetes, you can give insulin too. So these sort of a points relatively with the acute pancreatitis and sort of a chronic pancreatitis. But if you just want me to summarize it related to the pancreatitis pain location, related to the risk factors, related to the complications, so I'll just tell you those sort of points too. So if you just want me the pancreatitis pain location, it starts in the upper middle or left part of your belly, and it may spread across your back or up your left shoulder blade. Okay, so that starts from the upper middle part of your belly, then it is like spreading across your back and to your left shoulder. Okay, so this is the pain location when you're finding for the pancreatitis. And if you want me to tell you this risk factors, so some of them are like heavy drinking, 4 or more drinks per day if you are having, so definitely that is a risk factor. There will be smoking and vaping. There would be obesity. If I tell you, the BMI would be 30 or it could be higher. If you're having a diabetes, if you're having a high levels of triglycerides, and there is one sort of things that you're having a family history of pancreatitis, definitely there would be a chances that you will also face that. Okay, and complications, if I tell you, first is diabetes. Then there will be infection of your pancreas, there will be a kidney failure, as I already told you. There would be a problem in your vital organs relatively because of pancreatitis. There will be a weight loss, malnutrition. Malnutrition just because you are not getting enough nutrients through your food, so you will be definitely facing malnutrition. Blockage of the bile ducts, there will be gallstones and everything, so you could have faced that blockage also. There would be a pancreatic necrosis, problem with your breathing. When you are facing some sort of issues, you definitely have an issue related to the breathing too. And there would be a pseudosis, and most severe, if you can say, you are facing the pancreatic cancer. So these are some sort of points which is related to the pancreatitis. And I hope you definitely got an idea how we can define these sort of the types related to the pancreatics, and what are the symptoms. So you can just check out my more videos too, and I'll definitely uploading a lot of videos related to another sort of diseases, another sort of organs related to the symptoms and everything diseases. So you can just check out my videos, and you can just share it with your friends. So thanks for watching me. Meet you in another video. Bye bye, take care.